we had a member who was just asking for some advice and anything she should change in her healthy living regimen as she gets older and ages. Do you have any changes or recommendations there?
Well, probably women are at increased risk of osteoporosis, but for both sexes, we have a tendency to lose muscles and bone strength as we age. So I think we have to put more attention to weight-bearing exercise and exercise in general, to put more time in your life towards exercise as we get older, to try to maintain our muscle mass and bone strength we had when we were younger. And you should be doing that all through life. But as you get older, you should pay more attention to that. And perhaps the absorption of calcium goes down a little bit, and zinc. So maybe that this woman should be taking a low-dose calcium, like our osteobiotech, with meals, which has a little extra K2 in it, to maintain her bone mass, and make sure she's give people extra zinc. But the three supplements that are most important to make sure you have adequate amounts are of course B12, DHA, EPA, and zinc.
Oh, and zinc.
Zinc.
Oh, I didn't realize zinc was
those
so
are the three things. Zinc's so important for immunosenescence, decline of the immune system with aging, and neurosenescence, the design of the brain with aging. It's not just EPA and DHA, it's zinc as well. So zinc adequacy. And those are the three things that are low in vegan foods and plant-based foods. So we're paying more attention to that. And the added thing with aging is making sure they take a little bit of food-based calcium, not a calcium supplement, which spikes too much calcium in the bloodstream at one time, but a food-based calcium with a low amount of calcium that just adds a little bit of calcium to meals, a little extra.
So in the optimal amount.
So it pushes it up to a little bit more absorption, so women maintain maximized bone mass.
What about a protein powder? Necessary or just nice to have? Like one that's plant-based with extra nuts, seeds, protein from beans?
It's probably not necessary for most people, but you understand that these plant foods have a lot of protein in them. We're talking about whole grains, green vegetables, beans and nuts and seeds.
Yeah.
But then if you eat white rice and oil and sugar and you start to dilute the protein in the natural foods with processed foods, then you could push your plant-based diet with too low in protein. Then you got to have protein powder, make up the oil you added to your food. Because as you let's say you took a third of your diet as oil. Well, that's a third of your protein you took out of your diet, a third of your calories. But you're right though. Some people require some more protein, and they can meet that with soybeans and with quinoa and with hemp seeds.
Right.
But for some people it's easier, and they could also meet it. For some people who they're starting to get too frail, lose too much bone mass, and as protein absorption goes down with aging, it's an individual thing that they require a little more protein, and they don't feel you want to overeat to get it. They want to just have a little protein powder and get a little more with a pea-based protein or hemp seed-based protein. So for some people, it may be something that they want to consider, but it's certainly not necessary for everybody.
Okay, you said this twice, and I just want to be clear about it. Is white rice, or is rice a processed food? Is that what you consider a processed food?
Yes.
Really?
White rice is a high glycemic carbohydrate, and white bread I consider a sugar equivalent. White rice is almost a sugar equivalent, meaning that it spikes sugar so high in the bloodstream. And the sugar equivalent, I don't consider it a food, I consider it a drug, because it acts on the brain more like a drug than it does like a food. So white rice is kind of like a drug, and white flour is like a drug, because you're trying to metabolize energy without the nutrients, without the protein, without the cofactors, without the antioxidants. You're just taking in, so it's not really it's not a food that's meant for humans' consumption.